Americans who died from drug overdoses last year is higher than those who died in car crashes or from gunshots. Overdose deaths are up 10% from last year alone.
CDC earlier this week showed the number of pregnant women who are addicted to opioids has more than quadrupled over the last 15-year period that's been studied. Our medical expert, Dr. Mandira Mehra, is here this morning from SSM Health to talk about this data. Good morning. Good to see you.
Good morning. Great to see you.
So it's 6.5 women now in every 1,000 births. The impact of this epidemic, I mean, that's just a striking figure.
Absolutely, and I know we're talking about all these numbers and we talk about car crashes and other disease processes, and you think, wow, maybe this is a whole population of deaths that could be avoided. Whenever we see something that affects people so broadly, it definitely affects even the pregnant women population. And so this is something that over the past 15 years has quadrupled. Unfortunately, in this population, women are very worried about their own health, of course the baby's health, but they're also worried about judgment. And so they're very scared to sort of seek out help and even be honest with their healthcare provider because they're afraid of the consequences, A, being viewed negatively, and B, the fear that perhaps their child will be taken from them.
What kind of an impact on unborn children does an opioid kind of addiction cause?
And that's a great question, Adam. So this is the reason that we care. Why do we care? We care because this is prescription opiates as well as illicit drugs like heroin. Of course, it can have an impact on the baby, stillborn births, neonatal syndromes. They can be born addicted to medication, of course, respiratory issues, but of course it can cause death in the mother as well. So very, very serious consequences. So, you know, if you are one of these women, please do seek medical attention. It is surprising, though, how different the laws are in states. And so if you look at 23 states in the U.S., they actually consider this substance use child abuse. And so, again, that makes women very fearful to sort of seek help or be honest. So they show up in the labor and delivery units, and then suddenly, you know, hospitals or these delivery units are unprepared to, you know, help the women.
We wanted to go on this subject as well and talk about this new survey out about college students. About 1 in 5 say that they know someone who was addicted to pain medications. A third know someone who overdosed on painkillers. I mean, these numbers seem pretty startling.
Yeah, and it's just like we were just talking about. This is affecting everybody. It's not just affecting the old, the young. Really, no population is immune to this, unfortunately. As kids are heading back to school, and it's obviously a conversation you'd want to have with your kids, or if you're a physician and you suspect this in the child that you treat, this is something to talk about. But it's amazing because many studies look at, of course, the primary user. How does it affect the primary user of these opiate substances, of drug abuse, of alcohol abuse? Very few studies look at the secondary impact.
Sure.
So those of us, even these college students that know somebody, 1 in 4, 1 in 3 know someone that has passed away from this, you know, huge epidemic. How does it affect them mentally? How does it affect their school burden?
Well, it makes sense. I mean, loss is loss, whether it's from cancer or from addiction.
Exactly. And so again, we always focus on the individual. How does that person from cancer, the person from opiate abuse, how do they deal with it? But we definitely need more studies to say, how does that secondary exposure really affect them? College kids are burdened with tuition and the job market, and just the studies alone, they should really be focused on all of that. But these kinds of things are impacting them as well.
Really interesting.
Yeah.
All right, Dr. Mehra, good to see you. Thank you so much. Appreciate it.
Thank you.
Good to see you. 6:18 right now, and coming up, we will introduce you to a cottage